Ibu Tablet, also known as Ibuprofen, is a nonsteroidal anti-inflammatory drug, NSAID, used to relieve pain from various conditions such as headache, dental pain, menstrual cramps, muscle aches, or arthritis. It is also used to reduce fever and to relieve minor aches and pain due to the common cold or flu. Ibu Tablet works by blocking your body's production of certain natural substances that cause inflammation, helping to decrease swelling, pain, or fever. If you are treating a chronic condition such as arthritis, it's important to ask your doctor about non-drug treatments and/or using other medications to treat your pain. When taking Ibu Tablet, make sure to check the ingredients on the label, as the manufacturer may have changed the ingredients, and products with similar names may contain different ingredients meant for different purposes. It's important to take the correct product to avoid harm. The recommended daily dosage of Ibu Tablet should be followed as per your doctor's instructions, and it is best to take it with food or milk to prevent stomach upset. As always, consult with your healthcare provider for the best time to take this medication. When taking the over-the-counter product, make sure to read all directions on the product package before using ibuprofen. If your doctor has prescribed this medication, be sure to read the medication guide provided by your pharmacist before you start taking ibuprofen and each time you get a refill. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth, usually every 4 to 6 hours with a full glass of water, 8 ounces/240 milliliters, unless your doctor tells you otherwise. Do not lie down for at least 10 minutes after taking this drug. If you experience stomach upset while taking this medication, take it with food, milk, or an antacid. The dosage is based on your medical condition and response to treatment. To reduce the risk of stomach bleeding and other side effects, take this medication at the lowest effective dose for the shortest possible time. Do not increase your dose or take this drug more often than directed by your doctor or the package label. For ongoing conditions such as arthritis, continue taking this medication as directed by your doctor. When ibuprofen is used by children, the dose is based on the child's weight. Read the package directions to find the proper dose for your child's weight. Consult the pharmacist or doctor if you have questions or if you need help choosing a non-prescription product. For certain conditions, such as arthritis, it may take up to 2 weeks of taking this drug regularly until you get the full benefit. If you are taking this drug as needed, not on a regular schedule, remember that pain medications work best if they are used as the first signs of pain occur. If you wait until the pain has worsened, the medication may not work as well. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. If you are using the non-prescription product to treat yourself or a child for fever or pain, consult the doctor right away if fever gets worse or lasts more than 3 days, or if pain worsens or lasts more than 10 days. If you experience upset stomach, nausea, vomiting, headache, diarrhea, constipation, dizziness, or drowsiness, make sure to let your doctor or pharmacist know. It's important to note that while some people may experience these side effects, many others do not have any serious side effects. It's also important to monitor your blood pressure regularly while taking this medication, as it may raise your blood pressure. If you notice any serious side effects such as easy bruising/bleeding, hearing changes, mental/mood changes, signs of kidney problems, vision changes, symptoms of heart failure, or symptoms of liver damage, be sure to contact your doctor right away. Although a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience symptoms such as fever, swollen lymph nodes, rash, itching/swelling, severe dizziness, or trouble breathing. And remember, this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA, and if you are in Canada, you can report them to Health Canada. Nonsteroidal anti-inflammatory drugs like ibuprofen may increase the risk of a heart attack or stroke, especially if taken for a long time. This risk is higher for older adults or those with heart disease, high blood pressure, or diabetes. It's important not to take ibuprofen right before or after heart bypass surgery. There is also a rare risk of serious bleeding from the stomach or intestines, especially for older adults. If you experience stomach pain, black stools, vomit that looks like coffee grounds, chest pain, shortness of breath, weakness, or sudden vision changes, seek medical help immediately. It's important to talk to your doctor or pharmacist about the benefits and risks of taking ibuprofen. And always follow the recommended dosage and timing for this medication. Before taking ibuprofen, make sure to consult your doctor or pharmacist if you have any allergies to ibuprofen, aspirin, or other NSAIDs, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Before using this medication, it's important to inform your doctor or pharmacist about your medical history, especially if you have asthma, blood disorders, growths in the nose, heart disease, high blood pressure, liver disease, stroke, or throat/stomach/intestinal problems. Kidney problems may occur with the use of ibuprofen, especially if you are dehydrated, have heart failure or kidney disease, are an older adult, or if you take certain medications. Make sure to drink plenty of fluids as directed by your doctor to prevent dehydration and notify your doctor if you experience a change in the amount of urine. This medication may cause dizziness or drowsiness, and alcohol or marijuana can increase these effects. It's important to avoid activities that require alertness until you can do them safely and to limit alcohol consumption. Ibuprofen may also cause stomach bleeding, especially when combined with daily use of alcohol and tobacco. It's important to limit alcohol and stop smoking to reduce the risk of stomach bleeding. It's important to be aware that this medication may make you more sensitive to the sun, so you should limit your time in the sun and avoid tanning booths and sun lamps. Additionally, use sunscreen and wear protective clothing when outdoors to prevent sunburn and skin irritation. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be at a greater risk for stomach/intestinal bleeding, kidney problems, heart attack, and stroke while using ibuprofen. For women of childbearing age, it's important to discuss the benefits and risks of using this medication with your doctor. If you are pregnant or planning to become pregnant, make sure to inform your doctor, as this medication may harm an unborn baby and cause problems with normal labor/delivery. This medication is not recommended for use in pregnancy from 20 weeks until delivery, and if it is necessary to use this medication between 20 and 30 weeks of pregnancy, the lowest effective dose should be used for the shortest possible time. This medication also passes into breast milk, so consult your doctor before breastfeeding. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with ibuprofen tablets include aliskiren, ACE inhibitors, angiotensin II receptor blockers, citalopram, corticosteroids, lithium, and water pills, diuretics such as furosemide. This medication may increase the risk of bleeding when taken with other drugs that also may cause bleeding. Examples include antiplatelet drugs such as clopidogrel, blood thinners such as dabigatran/enoxaparin/warfarin, among others. It's important to check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers/fever reducers. These drugs are similar to ibuprofen, and taking them together may increase your risk of side effects. If your doctor has directed you to take low-dose aspirin for heart attack or stroke prevention, you should continue taking the aspirin unless your doctor instructs you otherwise. Daily use of ibuprofen may decrease aspirin's ability to prevent heart attack/stroke. If you must take ibuprofen, talk to your doctor about taking immediate-release aspirin while taking ibuprofen. Take ibuprofen at least 8 hours before or at least 2 hours after your aspirin dose. Do not increase your daily dose of aspirin or change the way you take aspirin/other medications without your doctor's approval. If someone has taken too much Ibu Tablet and is experiencing serious symptoms like passing out or having trouble breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include severe stomach pain, difficulty breathing, and extreme drowsiness. If your doctor has prescribed this medication, it's important to follow their instructions and not share it with others. Your doctor may order lab or medical tests, such as blood pressure or kidney function tests, while you are taking this medication. It's important to attend all scheduled medical and lab appointments. Consult your doctor for more details about these tests and appointments. If you are taking Ibu Tablet on a regular schedule and you forget to take a dose, take it as soon as you remember. If it is close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Do not take a double dose to make up for the missed one. When it comes to storing Ibu Tablet, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to getting rid of any expired or unused medication, it's important to consult your pharmacist or local waste disposal company for the proper way to discard it. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.